Hello, friend. Good morning. It's morning here. That's why good morning to all of you, and welcome back to ultrasound teaching videos with Dr. Arshad Nadeem Awan. As usual, I would definitely say, hope you're all okay. You are enjoying your life. You are practicing ultrasound. Uh, Today, my topic of discussion is congenital uterine anomaly. This is one of the important topic in the gynae section, especially those who are doing ultrasound. Sometimes it's a bit challenging to find out which type of anomaly it is, and many a time we forget what is next, which modality we will use to confirm all these congenital anomalies. Mind you that congenital anomalies occur when the caudal end of the molarian duct does not fuse. These two molarian ducts comes together and their caudal end fuse to form uterus, cervix and upper part of vagina. If due to any abnormality, like there are three main abnormalities which occurs and causes molarian duct dysgenesis. The first, if this development arrests, so this could be causing the abnormality of the molarian duct dysgenesis. If these both molarian duct does not fuse, it will give rise to congenital anomaly. Or due to some reason there will be a septa and septa does not resorb, so then molarian duct dysgenesis will happen. What if this molarian duct abnormality causes, like there will be three presentations. You will see uterine didelphys, there will be bicarnuate uterus, or there will be septated uterus. These are the three congenital anomalies. Sometimes there will be a subtype which I will discuss in this video, but believe me, if you just go one by one and understand this is because of this issue, so I'm sure you will be able to understand this on the ultrasound imaging, on the MRI, and it will be no longer difficult for you to identify the congenital molarian duct abnormalities. When you come across with congenital molarian duct abnormalities, or rather I would say congenital uterine abnormalities, so what you have to keep in your mind, you have to keep in your mind three important points. Number one, you have to take the thickening of the fundus region. Keep practicing this regularly. When you come across normal uterus, take the thickness of the fundal region time and again, time and again. So whenever you come across an abnormal fundal thickening, this will start ringing bell in your mind and you will definitely think of congenital abnormalities. The second, you have to look for the thickening of the myometrium. So always look for the myometrial thickening. If there is any discrepancy between the both sides, or if there is any abnormality or thinning, this will definitely show that there is some abnormalities. And if you ever come across septa within it, which is called a septated uterus, so always measure the septa. So these are the three parameters. So I have collected some of the images. These are ultrasound images and 3D images. So hope this will give you to identify some of the abnormalities, and you will be able to figure out what this is, and you may be able to get your head around all these abnormalities. So keep watching this video, and I'm sure to some extent this video will definitely help you. So let's start watching these images. On this image, you can appreciate different molarian duct abnormalities. It could be caused by either arrested development of the molarian duct, or maybe caused by failure of fusion of the molarian duct, or sometimes failure of resorption of the median septum. This classification is proposed by American Fertility Society, which is now called as American Society for Reproductive Medicine. So mainly there are three types of molarian duct abnormalities. Either it could be uterus didelphys, or maybe bicarnuate uterus, or either maybe septated uterus. When there is arrested development of the molarian duct, it will give rise to hypoplasia or agenesis of the either uterus or vagina. Here in this first image you can appreciate the fundal region, you can appreciate the uterus, both fallopian tubes are visible, but so far the fundal area is concerned, it is very short, very small. As I told you earlier that there are certain parameters while you're looking for the congenital anomaly, you have to look for the fundal indentation. Take the fundal thickening, it should have been more than 1 centimeter. If it is less than 1 centimeter, it means there is some hypoplasia or there is some agenesis. And the second thing is you have to look for the septal thickening, and beside this you have to look for the myometrial thickening, because these three are the parameters. So in this first image you can see this is because of arrested development of the molarian duct, and it gives rise to hypoplasia or agenesis of the uterus. Here you can easily see that only the fundal part is available and it is directly attached with the vaginal wall. So inside there is no cavity visible, you cannot see any uterine endometrial cavity, and this could have been possible on MRI scan. You can go for the MRI scan, and on the MRI scan you can find out this anomaly. On this image in the second part you can see unicornuate uterus. There must be a rudimentary horn, sometime it will be communicating. Here you can see the rudimentary horn endometrium, and its communication could be seen within the major endometrium. Sometime they will be non-communicating, although the rudimentary horn having its own endometrium, but it is not communicating with the main endometrial cavity, and this is a bit complicated one, because there will be a possibility of certain complication in such condition. Sometime in unicornuate there will be single cavity and the single horn, and another one is there will be single horn but there will be no cavity. So far this fourth entity is concerned, there will not be much complication, but as far as if you can see the top one where there is a horn but it is not communicating with the main cavity, so because it is blocked, so it will give rise to certain complication and ultimately it will causes rupture. So again, some of the slides on this video I will definitely show, and I will confirm it as an unicornuate uterus, but you need to have the MRI, because on the ultrasound imaging, unless you have a very great practice to appreciate all these abnormalities, you can do that, but if in case of any doubt, must go for the MRI scan. On the third image you can see didelphys. If you concentrate on, so you will see that there are two horns and they both are, their endometrial cavity is not communicating at any point, so this is called as didelphys uterus. And in the fourth you can see it is bicornuate uterus. Bicornuate uterus, it will show the two fundal areas, the two cavities, but at some point the endometrial cavity will join together prior to the cervix. Before the cervix, these both cavities would be joining together, so this would be considered as bicornuate uterus. These both patterns can be appreciated on the ultrasound imaging, but the best is to go for hysterosalpingography. Insert the dye, take the x-ray, and you will be able to understand. The picture would be clear, either it is didelphys uterus or bicornuate uterus. In case of any problem, again go for the MRI scanning. On the fifth image, this is septal abnormality. Septal effusion has not taken place, so that's why septa is still there, and which is parting both cavities. Within the one uterus there are two cavities. If complete septa is there, so it will be called as complete septated uterus, and if it is partial, so look at here, slightly indentation within the cavity you can see, so this is partial septated uterus. Again you can confirm it on hysterosalpingography, on ultrasonography, or even you can put the saline in and do the ultrasound scan. You can easily pick that on the ultrasonography as well. On image 6, it is called as arcuate uterus. Still, there are so many confusion whether some of the people consider it as an congenital anomaly, some of them not. But actually, there is slight indentation of the fundus within the uterine cavity. In that case, the fundal length would be or thickness would be less than 1 centimeter. So that would be considered as arcuate uterus. And on the hysterosalpingiography you can also detect that. On the ultrasound this may not be easily picked up, but on the hysterosalpingiography and the MRI scanning these anomalies can easily be picked up. Image number 7 is I'm not gonna explain that because it is a bit confusing, so I do not want it to confuse you. I have arranged some of the pictures, some of the images. Hopefully these next slides will show you certain images. These are MRI images and these are ultrasound images which will help you to identify to some extent these congenital anomalies on the ultrasound imaging. This is the image of normal uterus on three-dimensional imaging. You can see the uterus clearly, endometrium is visible, cervical canal is visible, fundal part is visible, myometrium can easily be appreciated. On the transverse image you can take the thickness of the endometrium as well. And on again I mentioned that this is three-dimensional imaging, and here you can see enlarged proper uterus with having a endometrium, and endometrial thickening is visible, myometrium is visible. So that is a normal uterus on 3D view. On three-dimensional imaging, arcuate uterus is visible. Here you can appreciate that fundus is slightly indented into the uterine cavity. So this is what actually arcuate uterus is. Some of author says this is not the congenital anomalies, while some favor it as a congenital anomaly. But anyhow, this is what the condition is, and on three-dimensional imaging you can see that the fundal part of the uterus is indented into the cavity. Well, it depends upon the indentation. If indentation is more than 1 centimeter, so it will cause any blockage within the uterine cavity. Otherwise, here you can see there is a sufficient space for the uterine cavity. Endometrial thickening you can easily see, internal area is also visible, and on the both side myometrium can be easily appreciated. So this is arcuate uterus on three-dimensional imaging. Certainly this image will explain you how septated uterus looks like. So this is what the image is, and this is septated uterus. In other words, you can call it as a partial septa, because at the lower end you can see this cavity is joining together. In complete septa there will be both separate cavities until the start of the cervical region. But here in this subseptated or partially septated uterus, you can see that the septa is coming down, but before the cervical region starting, here these fuse together, join together, and leaving small part of the cavity as a whole. So this is an example of subseptated uterus, or you can label it as a partially septated uterus. Here this slide explains complete septated uterus. You can see the center, the black area is actually the septa. So that's why while scanning or while looking for the congenital anomalies, you have to look for the fundal indentation, you have to look for the thickening of the septa, and beside you have to look for the third point, that is a myometrial thickening. So always keep in mind that whenever you think that there is some complicated or there is some congenital anomalies, look for all these three parameters. So this is a clear example of the complete septated uterus. The septa is within the center, dividing the uterine cavity into two until the cervical region, until the cervix. This is both, these are two cavities, endometrial cavities. So this is called as complete septated uterus. So here is the example of bicornuate uterus. This can be easily picked on the ultrasonography. This is the ultrasound image, and here you can appreciate two horns of the uterus. One is on the right side, another is on the left side. So these are two fundal areas. These are called as two horns of the uterus. So that's why it is called as bicornuate uterus. In bicornuate uterus, usually these horns sometimes unites together before the cervix. So at that case, this would be considered as a bicornus unicolus. But if in case these both horns are separated until the cervical region and cervix is also separated, then it would be called as a bicornus bicollis. But in this case, this is bicornus unicollis because cervix is one and only two horns is visible. It's very easy to pick on the ultrasound imaging, and you can appreciate this. The picture will look like this. This is bicornuate uterus. Here we can see the image of uterus diadelphys. In the uterus diadelphys, you can see both right and left horn, but the white arrow is indicating small cervix. So it means that both cervix are separated. Both cervix are, there are two cervixes. There are two fundal areas. There are two uterine cavities. So this will be called as uterus diadelphys because of having two separate cervical canal. So that is a clear example of uterine diadelphys. And this is the slide of unicornuate uterus. Here you can see only the one, there is only one horn, there is no another horn, while on the previous classification I have shown you that there could be two horn. One horn would be communicating or may not be communicating, but in that case there is no horn at all, so it means it is less complicated. While in unicorn, when there is two horn and one horn is communicating and with the uterine cavity, still there will be no problem and this could be easily managed. But in the third entity, when the case is unicornuate uterus having another rudimentary horn, but it is not communicating, its endometrium is not communicating with the central endometrium. As a result, it remains separate and it causes a lot of complication, so which I have already discussed in the start section. Yes friends, this was all about congenital abnormalities of the uterus, which you can appreciate either on the ultrasound or 3D imaging or sometimes HSG, hysterosalpingography. So these are the modalities you can apply. Certain other modalities are also existing in radiological department, but they are very rare, and sometime you may need that. But before going towards that modalities, MRI, HSG and ultrasound will be quite helpful. So I'm sure there will be no much confusion left in regard to with respect to congenital abnormalities of the uterus. You will be able to understand and you will be able to identify diadelphys uterus and its different position. You will be able to identify bicornuate uterus, whether it is communicating or non-communicating or a single horn or whatever. You must be knowing all that. And beside this, a bicornuate uterus will no longer be difficult for you to understand and to identify. Beside this one another, that is septated uterus, whether this septa is partial or this septa is complete. So I have already discussed all these videos in this video, and especially this will help you out. If related to this abnormalities or related to gynae, any question, if you want me to discuss, so just drop me a message and I will get back to you. Take great care of yourself, look after yourself, and we will see in the next video. Till then, have a great day. Bye bye.